So welcome everyone to our first webinar of the Lifestyle Medicine series, Staying Connected, Healthy, and Energized During COVID-19 and Beyond. My name is Yael Khan, and I'm a Clinical Research Coordinator for the Lifestyle Medicine Clinic. The Lifestyle Medicine Clinic at the Mass General Cancer Center is focused on providing cancer patients, survivors, and caregivers with tailored recommendations for improving your physical fitness, nutrition, quality of life, or cancer prognosis. Our team is thrilled to be able to connect with you all over the next 6 weeks. This week's session tonight will serve as an introduction to lifestyle medicine and focus specifically on ways of staying active during this really challenging time. It is my pleasure to introduce our two panelists this evening, Dr. Betsy O'Donnell and Dr. Sasha Knowlton. Dr. Betsy O'Donnell is the Director of Lifestyle Medicine and a medical oncologist in the Multiple Myeloma Disease Center at the Mass General Hospital. As a Division I All-American in the sport of lacrosse during her undergrad years, Dr. O'Donnell's interest in lifestyle medicine stems from her own passion for athletics and health. Now at MGH, she works to empower cancer patients to reach their optimal level of wellness, both before, during, and after cancer treatment. Our next panelist is Dr. Sasha Knowlton, Assistant Director of Cancer Rehabilitation in the Department of Physical Medicine and Rehabilitation at the Mass General Hospital and Spalding Rehabilitation Hospital. Dr. Knowlton is a physiatrist specializing in cancer rehabilitation and treats patients at all stages of diagnosis, treatment, and survivorship to address functional impairments, pain, and quality of life. She is an avid skier and is passionate about improving the fitness and functional independence of her patients. Please note that during this presentation, you will be on mute, but you can post questions for Drs. O'Donnell and Sasha Knowlton in the Q&A box on the screen. We will reserve the questions for the second half of tonight's session. So without further ado, I'll pass it on to my colleagues.
Thank you so much for the wonderful introduction. As Yael mentioned, I'm Betsy O'Donnell, and I'm a medical oncologist at Mass General. I focus on the disease of multiple myeloma, which is a blood cancer. But in 2016, I started a clinic here called the Lifestyle Medicine Clinic. And as mentioned, wellness is a passion of mine. For anybody who's gone through cancer treatment, I think you know that there sometimes are limits to what we can discuss in our visits with our providers. And often many of the things that we want to talk about, our health, our wellness, exercise, diet, there just isn't time for. And so this is really a space that Dr. Knowlton and others here at MGH have tried to carve out for our patients to really get at some of those other issues that patients want to talk about. It's particularly meaningful during COVID. I speak for myself and probably many others where it's been a time where there's been some comfort eating and maybe a little bit of weight gain. And it's also been isolating where people haven't been able to have their normal routines. And so this series of lectures is really hoping to bring some wellness into people's lives, literally through Zoom. So I hope you enjoy our presentation. Next slide, please. So what is lifestyle medicine? So the lifestyle medicine, there's an American College of Lifestyle Medicine, and it has defined certain activities or things that one can do to improve lifestyle. So it's the use of lifestyle interventions such as exercise, diet, stress management, and smoking cessation in the treatment and management of disease. There are actually 6 pillars that are defined. Those are healthful eating, physical activity, managing stress, relationships, sleep, and avoiding risky substances that comprise lifestyle medicine. Next slide. So how can it help patients? Well, there's actually data. So this is a field of medicine that's really been evolving over the last couple of years. And there are data that show that attention to these 6 pillars can improve quality of life, can improve side effects from treatment specific to cancer, can improve physical function, mood, fatigue, and can actually improve cancer outcomes. Next slide. So what's our mission? What are we trying to do here at MGH? Just to give you a little background, we're trying to provide personalized consultations for patients seeking to improve their physical fitness, nutrition, quality of life, and cancer outcomes. We have a clinic, we have multiple clinics actually in Boston at Waltham, and up at Danvers, where we can help set up consultations to discuss these issues with patients. The foundations of our program and the things that we seek to help patients with are exercise, so discussing ways to be active and to resume exercise based on your current fitness level or where you are in your cancer treatment. We have nutritionists who can provide individualized evidence-based advice to help you make good choices. It's interesting, most cancer patients that we talk to in lifestyle medicine clinic find that they've gained weight or seen changes in their body, the amount of fat versus muscle that they have, and are looking for some nutritional advice, not only for health during treatment, but getting back to healthier ways. Dr. Knowlton is a specialist in rehabilitation, and MGH offers this consultative service for patients who've had limitations or have lost physical functioning, helping to regain independence. Sleep is a huge issue for our patients, whether it be from the treatments themselves or for the anxiety associated with the cancer diagnosis. So our lifestyle medicine group and consultations help to improve sleep health, stress management. Again, life outside of cancer doesn't stop for cancer. And so there are so many stressors that can be involved during a patient's care before, during, and after cancer treatment that we help to focus on, think about mindfulness, some meditative strategies, and also positive behavior change. We have health specialists, behavior specialists that can help patients enact wellness plans for making these healthy lifestyle changes. Next slide. Our goals in our clinic are to address physical functioning and lifestyle management, prehabilitation, which is using physical therapy or personalized fitness training before cancer treatment to optimize those outcomes, helping cancer patients exercise during treatment, and then after treatment, helping patients get back to restoring function or maybe even setting a new higher standard. Next slide. So if lifestyle medicine consultation for our patients and anybody who's interested in this, frankly, you don't have to be an MGH patient, any oncology patient seeking physical activity recommendations at risk for loss of function, in need of optimization, overweight, or having any cancer-related fatigue syndromes, you can have a complete assessment with us. We'll ask you to complete a health behavior survey prior to your visit, and we'll use that as a tool to help address the things that are most important to you that may not have time within your normal cancer visits to address. We'll go through this evaluation, assess your needs, help make some recommendations, and talk with your primary oncology team about how that might be enacted within your care. We can also pull in the resources of the general hospital, such as physical therapy or weight management, to help you meet your goals. Next slide. We're also interested in doing research. This is an area, as we'll talk about over the course of this evening, that is exploding with information about how wellness may impact cancer outcomes. We are part of that research. We are developing clinical trials to focus on treatments to prevent loss of function. We're collecting data to understand the physical functioning and body changes that occur during cancer therapy, so that as oncologists, we can better prepare and address those while patients are receiving therapy. And being a general hospital, we're able to build collaborative research program with our colleagues in cardiology, physical therapy, behavioral medicine, sports medicine, rehabilitation medicine, surgery, and radiation oncology. Next slide. Our current research protocols include a pilot study to assess a boxing fitness program for cancer survivors. That's ongoing now and fully accrued, and the kind of trial that we're hoping to be able to offer to more patients. We have a brand new pilot study to assess prolonged nightly fasting in breast cancer survivors. That is an activated study that is now open to accrual for people who are interested. And we're also studying quality of life and psychological distress in patients with multiple myeloma and their caregivers. Next slide. This is our team. Obviously, there's me. We have Dr. Milstein, who is a behavioral medicine specialist, Jessica Garden, a physical therapy expert, Carol Sullivan and Samantha Bateman, nutritionists. Lauren Winters heads up our Waltham program. She's a nurse practitioner and she's a certified yoga instructor. And Dr. Knowlton, who's a specialist in physical medicine rehabilitation, who you'll be hearing from shortly. Next slide. So a brief history of exercise in oncology. You're not meant to read the fine print here, but what I'm hoping you'll take away from this slide is that there's a mounting amount of evidence for the use of exercise within cancer training. Cancer therapy, excuse me. The first exercise studies only date back to the 1950s. The first exercise study was published in Lancet Oncology, looking at the differences in cardiovascular health for bus drivers versus the conductors going up and down the aisles, taking tickets and putting bags up. And what they found was that those who exercised, the conductors moving throughout the bus, had lower cardiovascular risk. And that was really the first study to look at that. Over time and over the last couple of decades, there have been more and more studies, all of them demonstrating that exercise can be safe and beneficial to cancer patients. Next slide. One such study is this meta-analysis. This looked at 66 high-quality exercise studies. I think what many cancer patients worry about is it safe for me to exercise? And what it found, or will it help me as I'm going through therapy? And what this meta-analysis found was that across the board, there were improvements in patient-reported outcomes such as quality of life, fatigue, and anxiety. There were improvements in physiologic outcomes, so body mass index, muscle strength, and fitness. And that exercise was safe. There's a low incidence of adverse events or side effects, negative side effects from exercising. Next slide. Some more specific outcomes from exercise research that have been done in cancer show that women who participated in moderate exercise, 3 to 5 hours per week, had a 50% lower risk of breast cancer recurrence, breast cancer death, or death from any cause, 50%. The same was shown in colon cancer patients who engaged in 18 met hours per week. So that's the equivalent of walking 6 or more hours per week, had a 47% improvement in disease-free survival compared with inactive patients. Both breast and colon cancer patient survivors who increased their physical activity following their diagnosis experienced a decreased risk of dying. Next slide. This is another study from breast cancer in which you can see that top black line is the probability of cancer death for those who exercised less than 1 hour per week versus those on the lowest line who walked more than 2.5 hours per week, showing again that exercising 2.5 hours per week lowered the risk of breast cancer related death. Next slide. A lot of the research that's been done is in breast cancer, far and away. But is it generalizable? Yes. There are data in colorectal cancer. Next. Prostate cancer, lung cancer, ovarian cancer, brain cancers, and even in bone marrow transplant. Exercise has been studied and shown to be safe and beneficial. Next slide. How does it work? What are the pathways? How do people get better? Well, it's really interesting. I'm not going to go into the weeds here or the deep details, but there are multiple levels within your body that exercise can be beneficial. Obviously, there are changes in terms of body fat and muscle bulk, but below that, there are pathways that are affected by activity, such as the insulin and glucose regulation, all of which are critical to your well-being. Inflammation and inflammatory mediators can be altered and improved by exercise, and even at the very micro level, there are benefits from exercise. Next slide. One of my colleagues here at MGH did her PhD research studying exercise in cancer, and she used mouse models for her work. On this slide, what you can see, the gray line represents sedentary mice, and the black line, the lower line, exercise mice. And she looked at tumor volume. How fast did a tumor grow in these two different populations of mice? And what she found was that the mice who exercised had a lower tumor volume than those that were sedentary. Next slide. She then did a randomized trial in mice. She took 4 groups of 17 mice. 17 had no treatment, 17 got chemotherapy, 17 exercised, and 17 got the combination of exercise and chemotherapy. And she looked at their tumor growth rate. Next slide. And what she saw is the tumor growth rate was highest in those that didn't receive any treatment, so no exercise or no chemo. And the tumor growth rate was lowest in those who combined exercise with chemotherapy. Next slide. So why was this? She took it a step further and looked at what are the biological changes going on that may explain why she saw that exercise and chemotherapy improved outcomes in these mice. And what she saw was that exercise increased the number of tumor blood vessels. We know that when we exercise, we start to make new blood vessels to our muscles, but this also occurs in tumors. And what it meant was that there was more uniform blood flow through the tumor. And her hypothesis was that it delivered more chemotherapy. And that's why she saw the benefits that she did for combining exercise with chemotherapy. So this is a little bit of the background of the research that's already been done to help establish that exercise is beneficial for cancer patients. From that research, there are now guidelines as to what cancer patients can do that may be beneficial. So Dr. Knowlton is going to take it from here, and she is going to talk about exercise and go into some greater details about what that can look like for you. Dr. Knowlton.
Excellent. Thank you, Dr. O'Donnell. And nice to meet you all. My name's Sasha Knowlton, and as it was mentioned earlier, I'm a cancer physiatrist working primarily at Mass General. So let's delve into a little bit, again, sort of reiterating what Dr. O'Donnell already talked about, but why exercise? So there's been proven benefits that exercise aerobically can reduce fatigue, help with insulin resistance and hip circumference, so losing inches. And it also helps with improving cardiovascular conditioning. In terms of strength training, which is lifting weights, doing all sorts of resistance exercises, it can also improve glucose control and decrease heart disease, and flexibility exercises are important too, which we'll get into. Next slide. So how much exercise is recommended? So there are recommendations that initially were published back in 2010 that were updated at the end of last year, 2019. And overall, 150 minutes per week of cardiovascular activity in the moderate range, or 75 minutes per week of cardiovascular activity in the vigorous range are recommended. Overall, resistance training or strength training is recommended 2 times per week, with some guidelines that are set here. Next slide. So what were the updates from 2019? Overall, over almost a 10-year course of data, lots of research studies have been published about how exercise is helpful for cancer survivors at all stages of treatment and disease. And so moderate to vigorous activity was found to reduce cancer risk, as Dr. O'Donnell went through earlier. The frequency, again, was that magic number of 150 minutes, though up to 300 minutes can be beneficial as well. And the prescription recommendation, I go over this with patients a lot, is, well, where do I start? And I'll get into that in the next few slides as well. But overall, exercising at least 3 times a week was recommended by these updated guidelines, at least 30 minutes per session, and trying to get a moderate intensity aerobic exercise was also included. Next slide. So the next few slides are going to demonstrate some images to help sort of understand the exercise guidelines a bit more. So overall, you know, if you're not a regular exerciser, it's not recommended that you start running a marathon. That is not healthy for a multitude of reasons. Instead, it's really, you know, starting, where should you start? And overall, it's, you know, trying to reach these benchmarks of 150 minutes. But if you're new to exercise, you don't want to do that right out the gate. Next slide. So the updated recommendations also came out and demonstrated that it really should be based on symptoms to a certain extent, and there has been a little bit of controversy about this as well since these guidelines came out. But overall, to improve symptoms such as fatigue, quality of life, overall function, sleep, bone health, anxiety, and depression, a combination of, again, hitting aerobic exercise 3 times per week with sessions lasting 30 to 60 minutes, and/or resistance exercise, and/or a combination is recommended. And again, next slide, resistance training, which is strength training, is helpful in multitude of areas. Specifically, and I'll get into this a bit, you do want to be careful with resistance training, particularly if you have underlying bony lesions, in addition to other issues, and I'll get into that in a bit as well. So when someone's telling you to exercise, either myself or Dr. O'Donnell or another practitioner, what does that mean exactly? Next slide. So when we're talking about moderate exercise, there's different scales, and you can base it on heart rate, you can base it on rates of perceived exertion. But overall, I tell patients moderate exercise is where you're able to talk, a little bit breathy, puffing a little bit, but you're not able to sing. Lighter exercise, you don't really notice the change in a breathing pattern. And vigorous exercise is where you're only able to say a few words without having to stop and catch your breath. Next slide. So some examples for those who are unfamiliar with different types of exercise. So light exercise are things like housework, slow walking, like dog walking, taking care of a child. So if you have an active child that runs around, it can be a little bit more on the moderate side. Whereas more moderate exercise is biking more than 5 miles per hour, gardening, participating in water aerobics, etc. Intense exercise is typically thought to be more of the jogging or running sports like basketball, hiking uphill, jumping rope, etc. So next slide. Overall, the general principles are to avoid inactivity. Don't be a couch potato, in other words. Trying to incorporate exercise as little as much as you can throughout the day overall will help with your health in multitude of areas. Next slide. So some guidelines. So if you're at work, which a lot of us, are working from home or doing, in the office or at home combination, really trying to incorporate little areas is helpful overall. So one example is when sitting at your desk or computer, getting up every 30 minutes or so to stretch. You should do that because you could develop neck pain or back pain as well. If you're on the phone, try standing up or doing a walking meeting. Next slide. When at home, if you're watching TV, getting up during every commercial. I know a lot of us have different streaming services, so maybe getting up, partway through the episode, etc. Using the stairs, trying to reduce time in front of the TV on video games. And if you're unable to really walk because of mobility impairments that are pre-existing, you can also try doing marching in place while you're sitting down, kicking out your leg like you're kicking a soccer ball, or doing arm circles as well. Next slide. So overall general principles of exercise, choose something that you enjoy, otherwise it's going to be a chore and you won't want to do it. Start slowly and build up to 30 minutes. Do it at least every other day. Aim for moderate intensity and try classes too. There's lots of online ones as well as in-person ones. So in terms of support, next slide. You want to talk to a fitness expert and you want to get screened by someone before you start an exercise program, particularly, depending on what your treatment history is, etc., whether you've had chemotherapy, surgery, or other interventions. Sometimes exercising with a friend can be helpful, or a training partner, or, if you have a Fitbit, you can do Fitbit competitions. And also motivational counseling can be quite beneficial as well. So a little bit about cancer rehab and what I specialize in. So this is a definition that was taken from really the first mention in the literature, which was back in the late 1970s, about what cancer rehab is. And overall, the goals of it is to improve quality of life, increase functional independence, improve symptoms, and prevent further complications. And cancer rehab can be integrated from the time of diagnosis throughout treatment, whether it's chemotherapy, radiation, or surgery, and months and years after treatment as well. Next slide. So in terms of physical therapy, therapists, which I tend to utilize a lot of, can be extremely helpful, particularly with getting started with an exercise program, or if you have another impairment such as weakness, etc. I tend to really use my physical therapists who have expertise in oncologic treatment and care. This because they understand the complexities that cancer survivors have. They can address specific musculoskeletal complaints and oversee customized conditioning and strengthening plans. Next slide. So as I alluded to earlier, before you start exercising, you should be screened by a physician. Why? You don't want to get hurt. You want to prevent injury. And also, depending on what your specific goals are, whether it's to lose weight, get in better shape, etc., your exercise program can be tailored. Next slide. So in terms of safety screening, the Part Q, the Physical Activity Readiness Questionnaire, asks a number of questions of you to see, do you have any chest pain? Do you have impaired balance? Do you have a bone or joint problem? It's basically a screening test that helps highlight a number of issues that could impair you or potentially injure you if you don't participate in the correct exercise. Next slide. So Some common misconceptions. Are you able to exercise during chemotherapy? And the short answer is yes. But if you have platelets less than 50,000, white blood cells less than 5,000, or you're anemic, certain precautions have to be taken. And this varies a bit by institution. There has been some published literature that has come out in the past few years setting guidelines of, especially for platelets, what's okay, what's not okay, should you do active range of motion or only passive range of motion, especially with resistance exercise as well. So yeah, the short answer is yes, as I said, but this is, again, why you should really have your care overseen by a medical professional. Next slide. So in terms of platelets and exercise, as I alluded to earlier, the guidelines do vary. I did my fellowship at Memorial Sloan Kettering, and they have, very specific guidelines where if you're less than 20,000 in terms of your platelets, you should have very minimal exercise. If it's less than 30,000, gentle exercise at the bedside is okay. If it's higher than 30, but not quite 50, exercise without resistance training, so no weights or anything like that, is okay. Again, a safety guideline came out back in 2017 that tried to change it up a little bit, whereas less than 20,000, it's okay to walk and it's okay to do activities of daily living, which are things like breasting, bathing, toileting, etc. 20 to 30,000, light exercise is okay, so maybe a little bit of dog walking, whereas 30,000, moderate exercise and light resistance is okay. So you can see that guidelines do vary around the country. Next slide. So what about bone metastases? Cancers that are likely to have bone metastases include these specific cancers, but other cancers as well, such as multiple myeloma, which is Dr. O'Donnell's specialty, can also involve the bone, and specific precautions have to be taken to prevent injury. Next slide. So bone metastases tend to go to specific bones. Sites of common involvement include the spine, the pelvis, the ribs, the skull, and the proximal long bones like the thigh bone, which is called the femur, or the humerus, which is the upper arm bone. And, particularly weight-bearing bones, you want to be quite careful because you don't want them to fracture, right? If you have a weak underlying bone because of a prior metastasis or a current metastatic site, you want to be careful that it doesn't break, because then you have to undergo surgery, potential radiation, et cetera, et cetera. So next slide. What are the no's in bone metastases? So if you're getting evaluated by a physician, by a nurse practitioner, by a physical therapist, manual muscle testing, which is, when they test to see how strong you are and they push against you, is a no-no. Passive or active assisted range of motion is also a no-no, and that's in the setting of the involved bone where the examiner essentially lifts the arm or lifts the leg or has the patient start lifting and they continue to complete range of motion, because you could cause the bone to break. You want to limit active range of motion by pain. So if someone is only able to lift their arm halfway because of pain, because they've got a known metastatic lesion in their humerus, then you don't want them to lift it up above that. Resistive exercises are generally contraindicated, meaning these shouldn't be done. So that's things like lift weights or squats if you've got, a femur lesion. You want to offload the area with an assistive device, such as a cane or walker if needed. You want to monitor for functional pain, because functional pain is the #1 predictor of a bone breaking. And functional pain is, if someone has a lesion in their femur or their thigh bone, they're walking, they have pain with walking that improves with rest, that's an indicator that that bone may break. You also want to tell them to avoid spine precaution or follow spine precautions, which are things like avoiding excessive spine flexion, so bending forward, bending backward, and bending forward and twisting, or bending backward and twisting. People do that, for example, when they're in the car and they're driving and they reach for something in the back seat. What happens is they have a moment of extension, they twist, and that puts a lot of abnormal torque on the spine, which could cause an area to break if they've got a known lesion in the back. So next slide. Other common, misconceptions. A little bit about lymphedema. So long story short, can you exercise with lymphedema? Yes. Can you lift weights with lymphedema? Yes. Should you wear a compression garment? Absolutely. And should you check your skin before and after to see if there's a tear? Because you don't want to get an infection in a lymphatic limb, and the answer is yes. So I'm saying all these yeses, but what's the evidence? Next slide. So over 10 years ago, the New England Journal of Medicine published a study looking at women who had lymphedema of the arm and who participated in a twice weekly weightlifting program. And it didn't have any effect on the lymphedema. It actually helped their symptoms and increased their strength. In a different population that was published in JAMA, which are, both of these journals are quite well recognized in the medical field. They took a group of 134 women who had no symptoms of lymphedema and gave them an exercise program with resistance exercises specifically. And introducing a weightlifting program did not result in increased lymphedema incidence. I do counsel patients to wear a compression garment while exercising. And again, and I drive this point home a bit more, always check your skin before and after. So with that, next slide, I'm going to turn it back over to Dr. O'Donnell to talk about a pet project that I was fortunate enough to participate in, but was really her baby as part of the lifestyle clinic.
Thank you so much, Dr. Knowlton. That was wonderful. And I think we'll have an opportunity when we're done here just to ask some questions. And if people do want to ask more about exercise, we're happy to answer those questions. I did also want to show you a resource that you may not know about. So we created, with input from Dr. Knowlton and from our physical therapist, a web-based exercise program that's free and accessible to anybody, not just MGH patients. We created 8 exercise videos, 2 easy, 2 medium, 2 hard, a cardio dance video, and a yoga video. These are all available on our website and also on YouTube. So if you are at home here at COVID and are looking for a free and accessible resource, we've created these videos. They all have one of our physical therapists modifying the exercises so that there's limiting the weight bearing potential for patients who may have bones that are more vulnerable. Yael, if you'll just click on it, we can show a little bit of a clip of one of these videos.
Elbow comes to knee. Nice, there you go. So now you're warming up your legs.
So the participants in these videos are a mixture of patients, family members of patients, and survivors themselves. You can see in the back, there's a woman with a lymphedema sleeve. So if you're interested, these are available on our website and would be a great COVID resource for anybody who is looking for some structured workouts to help get them started. Next slide. We also put together a sample schedule. So, one of the most important things to underscore is, 1, avoid inactivity. Even if you're not ready to exercise, try and do a little something, but 2, don't jump in too fast. If you're not exercising, we put in a little bit of an intro, which will help guide you over 4 weeks how to get back into exercise using these videos and even just walking and doing other things. Next slide. This builds into a 12-week exercise progression for those of you looking for something that is readily accessible, that will help over the next couple of weeks to months get you to a different place. Again, this is available on the MGH Cancer Center website and on YouTube, and is free for anybody who might be interested in looking for a program that might help them during this COVID time. Next slide. So our take-home points this evening are that exercise is safe for cancer patients. Before you start a program, you should be screened by your doctor or your nurse practitioner to make sure it's safe for you to get going. The overall goal is for 150 minutes per week, if you can get up to that point with both strength and cardiopulmonary fitness exercises. But always bear in mind that you have to tailor your exercise to yourself and make modifications for blood counts, bone involvement, lymphedema, or any other side effect of your cancer therapy that may need to be taken into consideration. Next slide. So that is the end of our programming, and we've left time for any questions. We're happy to take any questions you might have. or if you don't have any. It looks
So
like we have
it looks like there's a couple of questions that have popped up on the bottom. So I'm happy to, I can address, we can take turns if you'd like. One of them is talking about exercise when fatigued from chemotherapy treatments. So I deal with this question a lot when I see my patients currently on chemotherapy. And, you know, I always tell them to try to do as much as they can, right? Because the treatment for fatigue in the setting of cancer treatment or, you know, in cancer survivors, actually exercise. There's a huge plethora of evidence that's out there, you know, rather than using stimulants, other medications, you know, the treatment is exercise, but, and this is a big but, you have to find some middle ground, right? You don't want to over-exercise so that you're in bed the next 4 or 5 days, but, you know, you want to try to target your fatigue as well. And understandably, with chemotherapy treatments, there's, you know, everyone's path is a little bit different. And when you're undergoing chemo, there's certain days when you know you're going to feel, you know, more lousy than others, more fatigued. So trying to do less on those days, but a little bit more on the other days can be quite helpful. And everyone's different. Everyone's path is different. I always tell patients, you know, the goal is 150 minutes. If you can only do 100 minutes 1 week because you had chemo that week and you just weren't feeling up to it, okay, it's better than nothing. Try again next week for 150 minutes. I don't know, Dr. O'Donnell, if you have anything else to add to that question.
Absolutely. So, you know, I think all of this, you know, is, I always say to my patients, bad things happen fast, good things happen slowly. So this is all a work in progress, and you have to be willing to take your time and pace yourself. And just as you said, you don't want to go too quickly and set yourself back, but you do have to push yourself a little bit, because sometimes it seems counterintuitive if you're feeling tired and fatigued to then exercise. But really that is the most evidence-based, proven way to improve cancer-related fatigue.
All right. The next question we got was, can you describe in more detail the benefits of strength training for cancer survivors?
Absolutely. So, you know, I can start with my own cancer because I think it's a great illustration of this point. So a lot of the cancer therapies, particularly those that involve steroids, cause loss of lean muscle mass. So lean muscle mass are those long muscles in your quadriceps and such that help support you getting up out of a chair and help you with your balance. And so when you do strength training, that really helps to build back those muscles. And in the videos we made and in a lot of the advice that we give, we really try to focus on the muscles that help strengthen your ability to walk, to get out of a chair, and to improve functionality. In a more global sense, though, what does weightlifting do and what does strength training do in addition to helping you preserve your lean muscle? It also can enhance your metabolism. It creates the furnace that needs to be fed to help with some of your metabolic rate and to really help with some of these other issues that may tie together in terms of slowing metabolism. So there are multiple benefits to this strength training, and particularly in the cancer population where frailty can become an issue over the course of cancer treatment. Dr. Knowlton, do you have any other comments on that as well?
No, I think you summarized it well. I think, you know, really focusing on, you know, as people are, sometimes people have to be on chronic steroids as well, particularly in the BMT population. So sometimes it's difficult to find, you know, that balance when you're on a medication, you have to be on it for immunosuppression, and you're in the process of trying to wean off of it, particularly if you've had, you know, GVHD, et cetera. And, you know, it's sort of, you're trying to fight this, you know, uphill battle. So I think Dr. O'Donnell summarized it well.
Thank you.
Awesome. Next question. What about exercising if you have had a DVT or PE caused by a cancer-related medicine?
Yeah, so I'm happy to take this one. So in terms of a DVT or PE, it depends, number one, on when it was. If it was yesterday, then probably not the best idea to go out and start exercising right away, right? You want to make sure the clot is stable or has gone away. And, you know, if you have had a PE where the blood clot has traveled to your lungs, you want to make sure that your heart and your lungs are sort of up to snuff and that they're able to participate in an exercise program, particularly starting an exercise program, which is always a little bit rough on the system. So, if you had one years and years ago and it resolved, it's always a good idea, particularly if you did have a PE, to get checked by either your oncologist or primary care physician or pulmonologist or cardiologist if you've seen them in the past, just to make sure you're cleared for exercise, or if there's any parameters that you have to be careful of. If it's been more recent, like I said, yesterday, a week ago, etc., then you have to be particularly more cautious.
I agree.
Great. Next question. I have a new lytic lesion in the body of L5 from recurring breast cancer with no symptoms. It's 1.9 large. I do have yoga every morning for 7 to 10 minutes. Is that safe?
Either of us can take this, so I think we'll both comment on this. You have to be careful with lytic lesions, and part of lytic lesions are also the bone therapies that I imagine your doctors will be treating you with to help strengthen those bones up. Drugs like Zometa or zoledronic acid or denosumab may help fortify those bones that have been compromised. You have to be careful with weight bearing, and this is where guidance can be useful in terms of what your weight capacity are, particularly in that lower spine. However, exercises such as yoga can be extremely beneficial, particularly if they're not loading that vertebrae and or strengthening the muscles that support that vertebrae. So, absolutely could be encouraged.
Great. Next question. I've been exercising some on and off. I've been exercising some on and off, and lately I've been getting some muscle spasms in my quads and back while working out. Why is this happening?
So I can take that one, absolutely. So it could be a number of things, right? I don't know if you've ever, seen someone for back pain before, if these spasms are new, or, they happened years ago and they're sort of recurring, if you've had a history of sciatica and it's sort of, rearing its ugly head again. So, it could, all of those are non-cancer related things, but and I always tell people this, just being blunt and honest, you always have to make sure in someone who's had a history of cancer that there's no recurrence of cancer that's causing you pain. So it could be, again, it's just a regular degenerative process going on, or it could be something related to the cancer, particularly if it's new and you haven't had it before. So, it's tough to say without doing a full exam or seeing your history or looking at imaging that you've had done in the past. But there is a number of reasons that this could be happening. If you do, notice that you get worsening pain, spasms, numbness and tingling going down into the legs, new bowel or bladder issues, etc., those are all concerning. And that would be a reason to get seen by someone more urgently.
Great. Dr. O'Donnell, anything else to add?
No, I think that covers it.
Okay. Next question. I'm very active and was diagnosed with breast cancer at 48. I had a sentinel node biopsy. I specifically asked about any measures needed regarding lymphedema and was told that I didn't need to avoid anything or wear a sleeve. What is the evidence behind your recommendation to wear a compression garment? I'm 2 years out and haven't had any trouble yet, and I want to keep it that way.
Sure. So I'm happy to tackle this too. So if you haven't had any lymphedema in the past, that's good news. Absolutely. Lymphedema can, unfortunately, at times, sometimes rear its ugly head months and years down the line, though not as commonly, fortunately, but it can, particularly if you have a new insult. So I have seen a couple of, mostly women, unfortunately, where, no history of lymphedema, no prior issues, and then, they got a cut on the affected side, on the arm, and then they started to notice that the lymphedema, they were a bit more susceptible to it. So in terms of wearing compression garment, it's one of those things that, there's not a lot of hard and fast evidence to it, particularly if you haven't had lymphedema in the past. Should you wear a garment if you've never had a diagnosis of lymphedema? Probably not. Some people, around the country tend to err more on the side of caution, and particularly if you have had lymphedema in the past, or they say, you know what, you've got the garments, you've had issues with lymphedema flares in the past, just wear it when you exercise, but it's not as strong recommendations in people who haven't had a diagnosis of lymphedema.
Great. Next question. I know exercise is good for me. Often it is hard to find time with homeschooling kids, trying to work from home, feeling pulled in many directions. Any tips on how busy people can fit in exercise?
Sure. Sure. A favorite question I ask myself each night as I lay down in bed, where will I get it in? I think habits are great. So routine. And for working moms, and I'm a working mom too, for me, I'm not a morning person, but for me, that's when it's going to happen if it's going to happen. And so I set my alarm and I define that as my time every day, as my me time to get the exercise that I need that makes me a better person. And I consider it part of my own personal, responsibility. But for me, it's the mornings. And, having a defined time and a protected time is usually a good way to create a routine for yourself too. The more you get accustomed to doing something, the more likely you are to continue to do something. So trying to establish a routine is another way to gain consistency. But sometimes that's not possible, and there are phases of life where kids are more needing this in need when they're younger. And certainly during COVID, this is an extraordinary time of trying to carve time out for yourself. In which case, sometimes it may be that your exercise is with your family. So finding things that you can do, whether it be walks or biking, that you can do with your family, finding, ways to engage yourself, or just decreasing your own inactivity. If it is, a situation where you've got a young kid, you can't leave the home and you're the care provider trying to work, some of those tips about trying to do the pieces of your job or your life standing or mobile as opposed to sedentary can at least mitigate not being able to exercise the way you want to right now.
Absolutely. And just to add to that too, I mean, I have a little one at home and it's tough working, as, Betsy knows. And so I think, we're all human, right? And it's okay. Like I tell patients, I try to get 150 minutes a week. I don't always get it. I don't get it as much as I would like, but I think resetting the goal and, cutting yourself some slack is important. And if you do get that 150 minutes, treat yourself. When, my big treat is going to get pedicures. So if I do it, great. I can go get one when they ultimately open back up. Trying to find a little reward system. We're all little kids inside too, and trying to find something that's important.
Great. Before I had cancer, my weight was pretty stable, but since treatment, I've gained and cannot seem to lose the weight. Why is it harder? I'm on tamoxifen.
So these are really tough questions, and we can both comment on this. And just so you know, you're not alone. Most of the patients I see in my lifestyle medicine clinic are people just like you. And the average weight gain during breast cancer therapy is actually 20 pounds. And I think that's a little bit of a, it's something that people often have the perception when you get cancer, you lose weight, but a lot of people actually gain weight. That or their body changes. It doesn't look like it used to lose, because you lose that lean muscle mass and you gain fat. It depends on how old you were, where you were relative to menopause when you went on that breast cancer therapy. But if it pushed you into menopause, that does slow your metabolism down. And so sometimes it's harder to lose weight, whereas you were able to before when you were premenopausal. So there are a lot of factors that come into play before, during, and after your treatment, but it can be hard. And this is one of the challenges that a lot of women we see face. Sasha, I don't know if you have any other
So absolutely. So I treat a lot of women who are on tamoxifen, AIs, etc. And I get this question quite commonly. Sometimes, I tell them just change it up a little bit. If you've been doing the same exercise routine and you haven't noticed any changes, try something different. If you're a big walker, maybe try cycling. If you've been doing a lot of yoga, maybe try a little bit more walking up and down hills. Same thing with diet. It's harder now, particularly in COVID. And I jokingly talk to my patients about, there's COVID-19 and then there's the gaining COVID-19. And so I tell them, trying to make healthy choices. I know we've been, been trying to do a lot more vegetarian meals, using a lot more lentils, just trying to get creative because it can get boring all the time. But also, making healthy choices and changing things up can be helpful too.
And also changing the types of exercises. This is a place where increasing those strength and resistant exercises and gaining some muscle mass back may help stimulate your metabolism as well if you've historically been doing all core cardio.
And stay tuned for next week. We'll be talking more about nutrition and how to fight cancer with your forward. Next question. Another participant said, thank you guys so much for your advice. It has really made a difference in my daily life. Can you please explain in more detail how to link to the yoga videos on your site?
Absolutely. So I should have put the link up, and I apologize for that. So if you use Google, this is the easiest way to get there. So it's on the Lifestyle Medicine webpage for the Cancer Center and on Dr. Knowlton's Rehab page for the Cancer Center. But if you just Google MGH Cancer Center exercise videos, it'll come right up.
And I can post that as well in the comments section.
Thank you, Yael.
Next question, I think it might be the last one, but feel free to keep sending them in. We're happy to be here. The next one is, I also wonder, are you open for in-person appointments?
Yes, so that's a great question. So during COVID, we did shut down our supportive care services, limiting the access to the cancer center to those only getting chemotherapy. So the two services right now, we are planning to phase back into doing in-person visits at all three of our locations. Again, we see patients, the way it works is there's a visit in Boston, it's just me with a nutritionist. In Waltham, it's Lauren Winters, a nurse practitioner, with Carol Sullivan, one of our nutritionists. And Sasha is a one-man band up in Danvers, but there is nutrition support there. So we try to pair those resources at your visit. We are now offering Zoom visits with those same resources. And, you know, if you can't come into the Cancer Center, much of what we do is counseling, personalized counseling. And so we can offer that to you via Zoom as well, if that's something that you're interested in pursuing. And we're trying actually to move more of it. What we've found over the years is it's hard, particularly working parents or parents, working people or parents, adding a visit, especially coming into Boston, paying for parking, all of that adds to the burden instead of relieving the burden. So, you know, we are trying to use the virtual platform as a result of COVID and are interested in seeing how patients feel about that.
Awesome. Thank you guys so much. We have a few more minutes if anyone else has any other questions. Yeah, thank you so much for joining us. It was a pleasure. And just a reminder, we have 5 more sessions coming up for different topics every week. Next week is nutrition. So we're excited to see you guys there and bring in some more expert clinicians to give you guys some advice during this time.
Thank you all so much for joining us. And it's really our privilege to be a part of your care. Best wishes.
Thank you all.